Hi everyone, I'm Sharon, and for my practicum, I work with Chantel Singh, who is a pediatric professional practice consultant at the London Health Sciences Centre. So for my practicum, I perform an audit to look at the nursing and physician's practice when patients are put on any sort of continuous monitoring modality. So it can be continuous cardiorespiratory monitoring, SpO2, or ECG monitoring. Because the hospital is offering corporate ECG interpretation education to all the units that has ECG monitoring, which we do have in pediatrics, we decided to take this opportunity to do an audit to help us identify additional important factors to consider as leaders and educators are prepping for nurses to take this course. The significance of this project is that we want to promote best practices, to align practices with our hospital's physiological monitoring policy, and as well align with other pediatric partners, and lastly follow national pediatric standards such as the Choosing Wisely campaign. The intended deliverable is to provide recommendations to all the pediatric leaders and educators based on the results of the audit, and highlight to the leaders that ECG monitoring education is a priority in pediatric area. I performed 3 snapshots of random audits where I looked at factors such as the unit, diagnosis, whether continuous monitoring was ordered in the computer and ordered appropriately, nurse's documentation, and the duration that the patient was placed on the monitor, and lastly the discontinuation date. The outcome of this audit provided us with a fair amount of information on the current situation in terms of practice. When comparing the audit results to our hospital policies, significant gaps were noted as highlighted in the picture. There were many inconsistencies noted also during the ordering and the documentation process. The other major significant gap noted is that none of our nurses are trained to interpret ECG, and yet they're expected to have the knowledge, skill, and judgment to observe, interpret, and act on monitor information. So with all the gaps identified and the knowledge gap in ECG interpretation, it poses an increased risk for our patient safety and as well to a nurse's practice. So I provided a few recommendations by having a meeting with professional practice team along with the leaders and educators from all the departments of pediatrics to show them that the significance of my audit, and presented to them the need to prioritize ECG training for all staff, and lastly to take this opportunity to improve documentation and team collaboration. Overall, I thought this practicum provided me with a rich experience from learning how to perform an evaluation in the form of an audit. I really enjoyed the process of collecting data and being able to interpret those data and finally coming out with recommendations based on my literature search and using hospital policies plus other pediatric partners' policies. The biggest barrier that I encountered was having to present all the data and results in a short amount of time as leaders and educators' schedules were very tightly packed that week. So my mentor and I really had to condense our information and practice several times to be able to communicate all the critical points and for the leaders to really recognize the essence of the audit and the ECG education rollout. Thank you for listening to my presentation, and if you have any questions, please comment below.